Meet Mary Hogden. Mary is the manager of Peers Organizing Community Change. POCC is an Alameda County Behavioral Health Services program in Alameda County, California. It brings together people with lived experience receiving behavioral health services to influence the development, the implementation, and the evaluation of healthcare, mental health, and social policies. Mary's goal is to help transform the mental health system. She wants to meet the needs of consumers. It is what she and the diverse 1,600-member POCC organization are dedicated to. Their approach is a clear example of consumer-driven, community-based care, and their values are rooted in engagement with clients. In reflecting on her own experiences using telehealth, Mary admits that she isn't great with technology, and that's true for the majority of POCC members. She knows telehealth is convenient for some, like those with transportation problems, but there are also a lot of barriers. For Mary, it's easier to communicate and clarify in person, but virtually is very difficult. In one case, Mary had a physical health crisis where she needed to use telehealth. She reached out, but she never got a call back to address her health concern. After many calls, the system assured her they were going to take care of it, but it continued to be unresolved, and she remained frustrated. Mary sees these same barriers with the community she works with, and she advocates for the training, support, and resources her colleagues and their clients deserve. One barrier is that providers make assumptions about patients' digital literacy. Mary says,
sometimes providers take for granted that we all know this kind of stuff. Well, we don't. The majority of our people do not own computers. The majority of our people, if they do have a smartphone, they've never been on a virtual platform. So there's a real learning curve.
Another barrier is that on top of assumptions about digital literacy, providers use medical jargon, and that's also hard to understand. Mary says that many of the frustrations she's experienced with telehealth are shared across the POCC, and that's why the POCC's work is so important. POCC members are certified peer support specialists. This means there are people with lived experience with mental health conditions or substance use who have sought certification as professional peers. As such, Mary and the POCC bring a crucial and much needed perspective into the mental health sphere and are particularly well suited to address the many telehealth barriers that clients experience. Mary says, our whole goal is to help transform the mental health system and to see it through the eyes of people like ourselves, who we think are better able to describe what services we need and how we would like to receive the services. In response to the needs of their members, and given the challenges associated with receiving virtual mental health care, the POCC has provided many trainings on digital literacy to help members become acquainted with digital health platforms. They also prioritize understanding and eliminating judgment toward clients who participate in peer support groups. The POCC empowers those they work with to ask questions so that they have a better experience and receive better care, regardless of whether that care is provided in person or via telehealth. To quote their mission statement, the POCC highlights the importance of the community-engaged care and systems that are of, by, and for consumers in the behavioral health care system, related systems, and in the community. Suspend assumptions and invest in community-driven, community-engaged solutions to address digital literacy and integrated care. The strength of the lay and peer workforce, including peer providers, certified peer support specialists, and community health workers, is mighty.